Hello and welcome to In Touch with Durham County. I'm Deborah Craig-Ray, General Manager of Strategic Planning and Innovation. We are here virtually to bring you knowledge and information from Durham County government. You may be aware that the COVID-19 pandemic has had a major effect on our lives. Many of us have been in a position of facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Joining us for today's show is Dr. Mehul Mankad, Chief Medical Officer for Alliance Health. Dr. Mankad has been a member of the Durham community for over 20 years. We are devoting today's entire show to a conversation about mental health, including how the pandemic and the interruption of our normal social interactions has impacted us over the past year. Now that our world is beginning to return to pre-pandemic reality, he'll share some insights about how to adjust to that as well. Let's begin our show. Hello, Dr. Mankad, and thank you for joining us today. First of all, please share with our viewers a little bit about your background and expertise in the field of psychiatry.
Sure. Deborah, thank you so much for having me. It is a pleasure to be on your program and to talk to my fellow citizens of Durham. As you mentioned, I've been in the area since the 1990s. Came here to train as a psychiatrist after finishing medical school up north. And so I did that at Duke. Go Blue Devils, and have decided to stay and spend my life working with the people of Durham and surrounding counties. So a psychiatrist, as you know, is a medical doctor who specializes in mental and emotional health. And in that capacity, I worked both at Duke and at the VA hospital in Durham, right across the street, for about a decade and a half. But in the past 2 years, I've been working at Alliance Health, which some people may know is the organization that coordinates and funds mental health services for the Medicaid and uninsured population of Durham and beyond.
Mm-hmm. So in that role at Alliance, what are your primary tasks?
So one of the things that we focus on is ensuring the integrity of mental health services that people rely on. But another role is what you and I are doing right now, is to educate. And so we serve kind of a local function to help bring awareness to individuals who may or may not be engaged in services and need to understand what is available for them and how to get that care that they deserve.
Very good. So in March 2020, our nation and our world mostly got placed in a lockdown in an attempt to stop the spread of the coronavirus. What happens to people when there is a significant change to their normal routines in general?
Deborah, I'm so glad you're bringing attention to this topic because it's one that I think everybody who is watching and listening can relate to. It's not that different than the natural disasters that we have experienced in North Carolina, be it a hurricane or something else. And so I think that's really the blueprint that we can all use to kind of think about this. But in other ways, it's very different than dealing with a hurricane. You know, if you've been here for any of the hurricanes that we've experienced in North Carolina in the past, you may have a few weeks where you lose power or you've got to boil your water or something like that. And then kind of life goes on and we start to put things back together. In the depths of what we went through over the past year, I know I felt it, but I imagine others did as well, that there were some pretty dark times where it might have felt like there was no end in sight. And especially before we had an effective vaccine, I think a lot of people were wondering, well, gosh, is this what my life is going to be like now? And so to kind of come back to your question, how are people supposed to go through something like this? All I can tell you is that everybody has to adapt. Everybody has adapted. And everyone's way of adapting is unique to them. There are, healthy ways for people to survive and adapt. And I think you and I are going to talk about some of those.
Yes.
And then there are other ways that people adapt where in the long run or maybe in the short run, they're actually harmful to the person or maybe to the people around them.
So I know COVID-19 caused stress, anxiety, other feelings, I'm sure. What impacts would people suffering from this type of stress manifest typically?
That's a great question. I think two of the common ways that people respond negatively to a stress like this are depression or anxiety. And so if I could take a minute to just talk about each of those, and they are interrelated. There are certainly people that experience both depression and anxiety. You know, the difference between depression and just feeling the blues is the depth and severity. And so, you know, if you get down for a couple of days and you're able to pull yourself out of it, or you go and do something that you ordinarily like doing, and you're able to kind of get your head past feeling sad, that's not depression. That's just kind of feeling the blues for a few days. Folks with depression really struggle and are unable to feel happiness even if they are doing something that they used to enjoy. They may struggle with physical symptoms, difficulty getting out of bed or getting motivated to do the most basic tasks that they were able to do before. They may struggle with appetite issues. Their sleep could be very messed up. And so those are some of the parts of the depression struggle. Anxiety, you know, as I mentioned, can be interrelated or it could be separate, but the real kind of core of anxiety, besides the feeling of anxiety and feeling worried, is avoidance. And so a lot of folks who struggle with anxiety will identify either at a conscious level or maybe even, you know, they may not even be aware of it, but they tend to shy away from the things that make them afraid and that bring up that anxiety. And so those are kind of the two parts that people struggle with. Now, some have mentioned, well, gosh, I've heard of post-traumatic stress disorder, which some people think of as an anxiety disorder. Do I have PTSD, post-traumatic stress disorder, from COVID? And that is a very interesting question. You know, in order to have PTSD, you have to have experienced something life-threatening. And so I think a lot of folks would say that, well, maybe COVID qualifies for that. But then to make the actual diagnosis of PTSD, you have to have a host of very specific anxiety symptoms. And so I would say that while COVID and the past year of lockdown has been traumatic for all of us, I don't know if we all could say that we have PTSD from it.
I understand, yes. So, would difficulty concentrating and making decisions be concerning?
I think you're right. Concentration can be a factor with a variety of mental health problems. Some people have difficulty concentrating from depression. Other people have difficulty concentrating from anxiety. Other people have difficulty concentrating without depression or anxiety. But I think all of us have had to make decisions, sometimes quickly, and sometimes with enough time to kind of deliberate over the past year. And if you feel paralyzed and can't make a decision, that can be a problem too. You know, one decision that I have had to make, and I hope everyone has at least thought about, if not chosen a path, is whether to get vaccinated. You know, you weigh the information, right? You weigh the information for yourself. Look at advice from reliable sources, and then decide what to do.
Okay, so let's just quickly talk about the impact on certain categories of people. Let's start with
Sure.
frontline healthcare workers, medical professionals who are tasked with treating COVID patients 24/7. What type of stress were they undergoing?
Durham, as many of you know, if you just look at our flag, it is the city of medicine. We have some of the finest healthcare facilities in North Carolina, in the United States, and in the world. And so, you look to your left, you look to your right, chances are somebody on your street works for one of these wonderful healthcare facilities. And so we truly are blessed to have them in our midst. On the other hand, we have, in my opinion, an oversized share of the burden of taking care of people. So people, as you know, Deborah, they drive in and sometimes they fly in to North Carolina to get care at one of the facilities located here in Durham. And so you mentioned this question, what should people who work in healthcare look out for? There's two ways to think about this. One is what they would call primary stress, and the other is secondary stress. The primary stress is a lot like what you would expect, right? If you're somebody, let's say, that works in the emergency room at one of these fine hospitals in Durham, and day after day you are exposed to COVID, and you're thinking, my goodness, is my life in danger? Folks take that home with them, and that can really drag them down mentally, not just physically. But the secondary stress is something that we're just learning about and trying to understand, and that is being around the stories. Even if you have a job where you are not physically at risk from COVID, or maybe you have a job where you have gotten the vaccine and you are now protected, and on the one part of you, you feel safe, but on the other hand, you are just continuing to receive all of the pain and suffering that other people get from having to live during lockdown and COVID. That can wear somebody down as well. And so I think you're right. Those that work in the helping professions, healthcare providers, first responders, even school teachers, they are all at risk for both primary stress and secondary stress.
Yes. So let's talk about our senior citizens who may have been living alone and isolated from family and neighbors and friends. What might they have been going through?
All of us have a mother or a father or an aunt or an uncle, someone who is older than us, or they may know, family friends who are older than us. And those individuals have had to take greater precautions than everyone else, have had to lead a life of greater isolation over the past year. And that is on top of the isolation that many seniors were experiencing on a daily basis before coronavirus. And so I think, my heart goes out to everybody during lockdown, but there is a special place for individuals who are older and have had to take on the burden of additional isolation.
Yes, yes. So on the other end of the spectrum, we had our students of all ages trying to adapt to virtual classes, social isolation, and more. What are we seeing in our students over this period?
You're absolutely right. The good news about kids from a health perspective is that they have largely been spared the ravages of the disease. And so while they can get COVID, they are the least likely to have to get hospitalized or have serious complications, although those can happen. The challenge, particularly for the young ones, the ones under age 6 or 7, is that the added rules of COVID are something that are very hard to adapt to. If a kid was living and playing and having a kind of a full life on their street, it's very hard for parents to be able to communicate to them that you can't see your friend that lives just down the street, or we can't take you to go visit grandma an hour away. They're not accustomed to that, and it's very hard for them to incorporate and interpret that. One nice thing I'll offer is that we worked with the wonderful University of North Carolina Chapel Hill School of Social Work and developed a coloring book for young children. and it goes through very clear but also very basic explanations as to why certain things are happening and what can be done to help them cope and kind of move forward with their lives. And so you can download that as a PDF from the Alliance Health website, or we can get you a paper copy. We've handed out thousands of those, but we're happy to keep doing that. I love this coloring book. It's very straightforward. And I think the best way that it works, in my opinion, is that you can certainly hand the child a box of crayons to color in the pictures, but going through the text is something that the parent or guardian will want to do with the kid themselves and answer their questions.
We were earlier talking about how students reacted to the COVID lockdown. Let's talk about the parents a little bit. I mean, you had parents who were able to maybe work from home, but then their children were home and they had to also be a teacher. So, what type of stress would be manifested in that situation?
Oh, I think you're absolutely right, Deborah. My heart goes out to all fellow parents. I'm one of them, where you're just trying to get by, and so you've got your job that you're doing in another room or maybe just down the hall. You've got one or more children trying to learn virtually, and everyone trying to keep the noise level down, and it is quite a challenge. I think my recommendation about this would be twofold. One is to have patience and grace, to give everybody a break. And one of the nice things is that most schools have understood this. The other one is to check in with each other, the people that are living in your household, on a regular basis.
Yeah.
That may not be something that people are used to. You may be thinking like, well, we see each other all the time. We see each other at breakfast. We see each other at dinner. We go out and we do things together, especially since the lockdown rules are easing. That is not the same as having a conversation of substance. And so if you schedule it and say to the family that, look, we just need to check in once a week, once a month, whatever is right for the family, and see how people are doing, and how the situation is working out at home, and what can be done to make it work better.
Very good. So, during the past year, we all were overwhelmed by the news of the severity of the situation, the rising death toll. I mean, you couldn't turn on the news without seeing a big number in the corner of the screen. Overall, how did we react to that situation?
Well, that's a great question as well. And I wonder if there really is one answer, kind of like your earlier question about, what is the right way to adapt to the circumstances. Everyone's reaction to the news that's flowing, and you're absolutely right. I think for the first 2/3 of this, the news, at least to me as a consumer of the news, felt more negative than positive.
Hmm.
Every day the numbers were going in the wrong direction, and I felt helpless as to what I could do. And I'm a doctor, so I imagine that a lot of other people felt that same level of helplessness. And so that really was a challenge. And I can't say that there is a right or wrong way to consume that information. The one piece of advice that I would think about is thinking about how to consume the information. It is so easy in our modern world to keep the news on 24/7, whether you get it from the television or through the internet. You can just have it droning on and on in the background. And frankly, it's pretty similar. It doesn't change a whole lot minute to minute. It might change day to day. And so my thought is, and this is what I did for myself, is that I would consume my news, number one, from trusted sources, and then
Right.
number two, at specific times. And for me, I felt like twice a day was enough. And so I would check it in the morning before work, and then I would check it again in the evening after work. And in between, whatever was going to happen was going to happen. So I felt like I was trying to balance staying informed against information overload. And I've talked to some other folks, and that seems like a reasonable strategy.
Absolutely. Thank you. I was listening to NPR recently and heard a report about the increase of alcohol consumption during this period. Have you seen that? And would the overuse of other substances also be expected?
That is a great concern for a lot of us in healthcare. Right now, the information that is coming out is from small studies. The federal and state government data takes a little bit longer to be verified and authorized, and so this story is still being written. What we can say is that the prescription rate for anti-anxiety medicine like benzodiazepines and other things like that, so this would be medicines like Valium or Xanax, that is at an all-time record in the United States, and I could imagine North Carolina is like the rest of the U.S., and so that is a concern. We have also seen that, sadly, deaths from overdose are higher than they have been. And so I think you're right, Deborah, that one of the ways that people are coping and trying to get by is by relying on substances, and sometimes that comes to harm.
Yeah, yeah. So I know even our governor's order still calls for face coverings in some settings like, camps, schools, healthcare facilities. How should people respond in such situations when there's that confusion about masks, even when they've had their shots?
That's a great question, and I would direct folks to the North Carolina Department of Health and Human Services website. They have a nice frequently asked questions page just about face coverings. And so if you want to learn more about when and where you should and should not don a mask, that is one place to check. And there's other ways to find that information out as well. But as you said, Deborah, there are a lot of places where you no longer have to wear a mask. Certainly, the risk of transmission is lower if both parties are vaccinated. But even if you're not sure, it's very safe to not wear a mask if you're outside, unless you're in a very crowded outdoor situation. And then there are now places indoors where wearing a mask is optional. But the piece that I would offer for people to think about is that you don't want to compare your insides with other people's outsides. And so what I'm trying to say here is, if you see someone and they are masked, you really don't know why they're masked. If they see you and you are masked, they don't know why you are masked, unless you ask them and you find out. And so everybody is moving at their own pace with what is comfortable for them. And so when I go into the grocery store, which I just did yesterday, about half the people were wearing masks and half weren't. And that's okay right now. And we should all be okay with that. And just as we do with the children in school, I think a bit of patience is going to go a long way as we all figure this out.
Yes, absolutely. So, as things are beginning to open up, more people are returning to work, being asked to return to work. But then there are many people who are anxious about returning to work. How should someone address that issue with a mental health professional if they're concerned about returning to work?
I think the best way to start is to understand the facts. The best way to start is to understand the facts. And so if people are worried about something, they need to know what their risks truly are. there is a risk to all of us if we step out the door of our house. There is a risk to us if we get in our car. There is a risk to us if we get on an airplane. And those risks were there before, during, and after COVID. And so what you want to do is go into any of these new situations in the COVID and post-COVID era with your eyes wide open and with the facts. And what you might find is some of the things that you're afraid about really have to do with your own fear of change. And they may not be as dangerous as you may think, or maybe you've gotten so used to certain protections that it's going to take a minute to wind the clock back and say it's now okay to do this thing that I used to do a couple of years ago.
Absolutely. Now, some people have accessed physical and mental health care through telemedicine during the past year. What is telemedicine, and is it here to stay?
I think the first part to talk about is access. That's a big deal to me. It's a big deal to us at Alliance. And I do just want to put a quick plug in that we have a 24/7 access line. And so if folks are wondering whether they can get mental or behavioral health care and they live in Durham, we are happy to talk to you any day or time of the week and can give you resources. So
Great.
Access is key. How people are accessing mental health care and to some extent physical health care has changed so much in the past year. And some of those changes I'm excited about for our future. There are certainly times where you got to go into the doctor. Maybe you need a blood test done, or they need to, listen to your heart or lungs or something like that, and you need a real physical exam. But what we have learned is that maybe 80% or more of the behavioral health care that we have gotten used to delivering face-to-face could be done either face-to-face or electronically. Now, the best way to do it electronically, in my opinion, is through real-time, two-way audio and video, just like the way you and I are talking. Now, the great news is that all of us in Durham, I'm going to guess, have become experts on Zoom. So, if you want to see your grandkids, you're going to have to use the Zoom.
Yes.
So, I think people are more comfortable than they were a year ago seeing family and friends through teleconferencing software. And so having that available to see your mental health provider is something that we certainly have right now. And in the case of many healthcare plans is going to remain. And so I'm very excited about that, and I hope that does increase access.
That's very good news. So how can people get in touch with Alliance?
Sure. So we absolutely have this 24/7 access line. That is the first place to connect. And if you describe what sort of mental or emotional health care you think you need, then we can give you ideas about how to get it.
Well, we've certainly enjoyed this important and informative conversation with you today, Dr. Mankad. Thank you so much for all you do to help our residents remain safe and healthy.
Thank you so much for having me, Deborah. Stay healthy.
Thanks. Well, that wraps up today's show. Thank you so much for joining us. We'll see you next time on In Touch with Durham County. Cheers.